Assalamu alaikum, the communication day. The first scenario, patient name Miss Saida to 62 years old. Mr. Said, oh my God. Miss Saida, 62 years old, male or female, I don't know. Dr. Salma will clarify. Your role is the doctor in the general medicine medical clinic. Saida is known to have atrial fibrillation, chronic kidney disease, and congestive heart failure. She is on warfarin treatment. Her last INR was less than the target number. So she was given enoxaparin, and today she had black stool. Your task, speak to Mrs. Saida, discuss the situation, the need for hospital admission and treatment. Patient concern had an important funeral. She refused admission and kept saying, I want to leave. So she is female, not male, because it's written male up. Anyway, she is female, 62 years, Miss Saida. You're ready, Dr. Samia?
Yes.
Dr. Salma?
Yes.
Okay, here we go.
Hello, good morning. My name is Dr. Abdurrahman, the doctor in the clinic today. Can I confirm that you are Mrs. Saida and your age is 62 years old?
Yes, doctor.
Welcome, Mrs. Saida. So, Mrs. Saida, we are here today to discuss some issues regarding your health condition. Is it okay with you?
Yes, doctor.
Okay. Mrs. Saida, can you, before we proceed further in this, can you tell me how much do you know about your health condition?
Yes, doctor. Actually, I have some heart problem and kidney disease. I'm in a blood thinning medication. But when I went to my GB last time, he told me that my blood is not thin enough. So he gave me another medication, and today I'm having a black stool. So I want to know what happened actually.
So, Mrs. Saida, and how are you today? How do you feel now?
I'm good. I'm feeling good actually. I want to go out of the hospital because I have a funeral. Actually, I have to be there today.
I'm glad that you are feeling well. So, Mrs. Saida, what do you expect from our meeting today?
I just want to know what happened. Why I have this black stool.
Appreciate your concern. Yes. Yeah, you have the right to ask this question, of course. So, Ms. Saida, as you said, you have some conditions, and that's why you are on blood thinning medication. As a result of the test, the test which is testing the how thin is your blood, which came less than expected, the GB prescribed for you this Enoxaparin. That is the medication to make the blood more thinner. But as you know, any medication has its side effects, and sometimes these side effects could happen. Because this medication given, you have now some black stools, and black stools means there is some blood in your stool, which need from us further test and further investigation. Are you following me up to this point?
Yes, doctor. Yes, doctor. So why I have this black stool?
So as I discussed with you now, because you have been given this medication called enoxaparin, and this medication is making your blood more thinner. When the INR, when the test for your how your blood is thin came less, that means you are in a hazard of clot because of the conditions that you have already. Your heart failure and the problem in the kidney, your heart disease. That's why you are in a hazard of having a clot in your blood channel. and this might result in stroke or less blood coming to your brain or to your other organs, and this might lead, it's fatal and it's serious. That's why they prescribe this enoxaparin for you, which is a medication to make your blood more thin, but it has a side effects. That's why it make the blood more thin, and you are now suspected to be bleeding in your stool. That's why first thing we will stop this medication, and then we will do some test and investigation to know what is the reason, to confirm the diagnosis, and you will be under the care of multi-specialty team who is going to investigate you further. And we need, in order to do this, to admit you. Are you following me, Mrs. Saida?
Yes, doctor. So why you want to admit me? I am not. I feel good. Like I don't have any problem except this change in the stool, and I want
Yeah.
really to go out of the hospital today.
Mm-hmm. I'm glad that you are feeling good, and I appreciate your concern. I know how important the thing that you make you want to go out. Can you tell me why you refuse the admission?
Yes, doctor. Because my friend funeral is today, and I
Mhm.
have to be there actually to support their kids.
I'm so sorry for what happened to your friend. That is so sad, and I appreciate that you are willing to help them and they are there to help them. But your life is very precious to us, and this is very serious because you might be bleeding. That's why we need to make sure about that, to do some tests to make sure that you are safe. To be with the kids that you want to support, your friend kids, you need to be strong, and your health to need to be strong. That's why we want to keep you now. I can suggest for you some things to send anybody from your family to comfort them, or to be with them through social media. Uh, but you need to be admitted. Would you accept that?
Yes, doctor. But I'm really want to go there. Is it very important to stay in the hospital? So what test you want to do for me? You can do it and just I can I go?
I appreciate your concern. And it's not only about the test, it's also about treating you to prevent, because this is bleeding. So we need to know how much bleeding, and we need to prevent this from happening and stop the bleeding. We don't know until now. We need to evaluate you and to assess your condition, to know more about that. And if it is okay and your life is safe, we will be more than happy to release you. But for now, I appreciate if you understand that you need to be admitted for this. Is it okay with you?
Okay, doctor. But can you do it like for 3 or 4 hours? Go to the funeral and come back again? Is it okay?
Mm-hmm. So, Mrs. Saida, I appreciate your concern, and as we discussed, this is a serious issue. We don't know if anything, because this is bleeding, so we don't know if anything could happen to you in these 4 hours. I highly recommend you to stay in the hospital, but of course, it's your right if you decide not to do so.
Okay, doctor. I just want to know why my GB give me this medicine if it cause bleeding.
Okay, that's a valid question. I appreciate your question. Because in that situation, we, and our normal practice, that we are following you up with the test that I mentioned to you, which testing how thin is your blood. Whenever this test came less, that your blood is more thin, we need to make it less thin, we need to make it more thin. So that's why he gave you that medication to help make it more thin.
2 minutes
Uh,
left.
yeah, but unfortunately, as I told you, as I discussed with you, that any medication has side effects and has bad outcomes sometimes, that which could happen, especially in your condition, because the kidney problem and this problem. So that is the cause of this happening. This. So, Mrs. Saida, can I ask you some questions?
Yes, doctor, of course.
So, Mrs. Saida, firstly, with whom you are living?
Yeah, with my family, yeah.
So, anybody depend on you because you will be admitted with us here?
No,
Okay. So, Mrs. Saida, do you smoke?
no, doctor.
That's okay. So, do you drink much alcohol?
No, just occasionally.
So, how much occasionally? How much you drink in these occasions?
Yeah, just maybe 3 to 4 units.
Okay, that's reassuring. So, Mrs. Saida, now would you agree to be with us here today to complete the test and complete following you up and giving you the better treatment?
Okay, doctor. If
Okay.
it's range my life, it's okay. I can stay here.
Okay, Mrs. Saida, can you tell me how much did you get from our meeting today?
Okay, time is up.
Yes.
Yeah, well done. Thank you, Dr. Salma. Time is up.
Yeah.
Let's hear the comment from Dr. Samia. I can smell some traps in this scenario. I don't know. Chronic kidney disease
Actually,
with
I
kids. Yeah.
I give this because I'm not sure about how to deal with this. So I put it actually to know more from colleagues, but
Okay.
I think she did very well. Uh, but like when I she should fill the gap in the background when I tell her that I have uh, uh, kidney disease and heart disease.
Mhm.
Uh, yeah. Uh, no, I give you all the information actually. I didn't. Yes. Okay. No, it's good.
Okay, so it's
So
not an error
yeah.
because I read in the scenario chronic kidney disease, and as we know, Clexane or Enoxaparin is contraindicated in chronic kidney disease
I was
patients.
I
Yeah,
was wondering about that. I
exactly.
wrote I
Yes,
wrote it here. Is it an error because in enoxaparin is it not going with CKD?
exactly.
I was thinking that there is something in this scenario not going, but I was not sure.
Yeah, that's why I'm waiting for opinion from Dr. Samia.
Yeah.
If
Actually, that's why I put this scenario. Also, I'm not sure
so,
if it's
you didn't
error or
hear it
not.
from anyone,
No, no, I see it
and
just randomly, and I
okay,
bring here just to discuss. So I think she did well, but maybe it she like need to discuss about the endoscopy or something like that, or no need.
well, this is hidden agenda. This is hidden
Uh,
agenda, and
I will tell you
suppose yes.
something, Dr. Basim. I
Mhm.
searched the scenario. When the scenario is about medical error, they will usually write justification
Yes,
to be said to the patient, not
exactly.
justification for the error, but something. I searched in the scenario for this, I didn't find. So if they did not say anything, I cannot
Yeah,
say
I
that
was
it
about
is
to
an
say
error.
that it will be in
Mm,
the task
mm.
that it's medical error.
And so,
Let's
Dr. Basim,
assume, yes,
just one, I don't think it's completely contraindicated, but it
yes,
sometimes can be
maybe less
used with
than
caution and
exactly,
low dose. Yeah.
exactly, yes.
Mm,
There is a number in the GFR, right?
Yes,
mm,
yes.
I think it was less than 30 or something like that. So let's assume it's not an error. So it will be as a complication, as you said.
mm.
In this way, you did perfect, Dr. Salma. You covered the all possible point to be covered, apart from one more point you didn't discover, which is
Diet.
interactions,
Mm.
other drug
Interaction.
interaction, and
Mm.
also food. But how you can do it? Tell me.
Mhm. Okay. Let us say by asking in the social. Like,
If you
yeah,
ask, it will be like a history taking, right? So
or giving safety net in the end.
I guess so. So at the end, after exploring the smoking and alcohol, because these are also possible cause of
I will tell you
interaction.
something.
Smoking,
I will tell you something.
yes.
Also, during discussing the plan of management, I can tell her that the group of specialty containing a diet specialist who will discuss with you any dietary interaction with the treatment that you are taking. Or this is باللفة.
هو سوري دكتور باسم، هو السيناريو about the enoxaparin and the incidence of melena. We should speak about the hazards of melena on the congestive heart failure and how to deal with melena with the available given drug enoxaparin. We will forget about warfarin now, as this step was taken by the GP. Yeah, it is no sense, make no sense to speak about diet or vitamin K rich diet or something like this.
By the yes, I will tell you now, Doctor. I don't. What's your good name? Sorry, Doctor.
أبو هاجر أبو هاجر أبو هاجر.
Abu Hajar. Yes, your name. Okay, Abu Hajar. Okay, Doctor. Abu Hajar.
دكتور أحمد دكتور
If
أحمد.
we why you are giving this Clexane now or Enoxaparin now?
We didn't reach the therapeutic
Exactly.
target
So
of INR.
exactly. So we are aiming again to make it valid to start warfarin back, right? To resume the warfarin. This is our usual habit. We are giving enoxaparin to raise the BTT again, and we will resume warfarin soon. So we have to know why this patient
As a
didn't.
bridge, as a bridge therapy.
Exactly. Yes, bridge. Yes, it's not for life. It will not be lifelong medication. Enoxaparin never to be lifelong, right?
Yeah,
What I
I
mean.
know
just a bridge.
Yeah, as a bridge. So we have to explore why the warfarin not effective. She might be taking some medication which is interacting with the warfarin, or she might take some diet which again interact with the warfarin.
we can mention in the scenario after, later with the discussion. You will sit down with the
Yeah,
clinical pharmacist and dietitian
that's
to
why
reach.
exactly.
But the main
That's
issue
why
of the scenario, the main issue of the scenario to convince patient to be admitted, the hazards of Melena on his chronic kidney disease. How much is her creatine clearance now? The symptoms of chronic heart failure with anemia can be aggravated, maybe life threatening with CHF in congestive heart failure. Anemia will aggravate
exactly.
the symptoms. يعني
Absolutely right.
she missed speaking about the action she will be done and the hazards on her comorbidities.
No.
This is my point.
But she convinced her to stay. This is her task. This is the task here to convince patient to stay, not to explain what other association the patient might know about the congestive heart failure and the other condition she has. But now our task is to convince patient to stay at hospital. What to do? Either monitoring, or she can say blindly. They might do for you camera scan, or they might do for you some other scans you didn't specify, because camera scan not mentioned in the scenario. It might be hidden agenda, and if you add it from your mind, it will be harm. So I believe if you said I need from you to stay in order to do further scans to be sure that you are fine, as Dr. Salma did. She didn't specify anything, and I agree for that. No need to specify the endoscopy. It might be, but it's
Yeah,
not
Dr. Basim,
the task. Yeah.
sorry for interruption, and I avoided mentioning any scan or
Yes, I
anything
agree. I said that.
because maybe the patient at this moment will tell me, "You are going to keep me to do for me a scan." No, I am not going to stay in the hospital at all.
No, not only this.
Then
Not
the
only this.
examiner will be
Not only
very
this.
upset. Yeah.
There is for blood transfusion. She may need blood transfusion. يعني
Of
we don't know the level of hemoglobin with this
Exactly.
Melena.
So she need
Mhm.
to be monitored and scanned again. You
Yes,
didn't
yes,
specify what scan and what's monitor, but she need to
yes.
be in the hospital. This is the task. So don't specify the management plan unless it's written for you. Please for endoscopy, please for blood transfusion. That time you will speak about the task or advanced task, which is the next
Mhm.
step.
I
This is
think,
my
Dr.
opinion
Bassem,
again. Yes.
this scenario want to test you if you are going to make it like medical error or to make it like side effect, and how to deal with
or
the عنيد
exactly.
بالإنجليزي إيه؟
Yeah,
The patient, yeah,
how to
support
deal with
patient.
patient exactly, how to deal with
Mm.
patient for this or ask for discharge. This is
Yes.
the main task. It's not error. Clear, it's not error. If it's error, they will write for you medical error. And again, chronic kidney disease doesn't necessary to be in the advanced stage of kidney disease. It might be in the stationary course of chronic kidney disease. It might be chronic kidney disease stage 1, stage 2. All these stage is chronic kidney disease. But the one need to be monitored or not to give Clexane with is stage 5, for example, or end stage renal disease. So we will assume that it's chronic kidney disease with conservative management and without kidney harm, or it will not be the error. I mean, let's talk as a complication as you did. Monitor, admit the patient. You didn't. You said sorry for her, but you didn't say our condolences to your friend, family, and so on. You have to from the start. I agree with Dr. Rashid. He wrote it from the start. She told you, "I want to go funeral." Don't stop there.
I
Immediately say,
didn't hear
yeah.
her from the start. When I heard
Ah,
her,
okay.
yeah, I told her
Yes.
immediately, I'm so sorry for what happened to you, and I
Yeah,
appreciate
exactly.
that you are feeling like this for her, for his kids.
Exactly.
I used it also to convince her. You have to be strong
Yeah.
for them. Yeah.
Yes. Yeah. I agree you did it later, but I wanted to make it earlier. Whenever you feel something in the scenario, you need to be sorry with it. Do it initially. Don't wait for the next time because they might
Okay.
say you are late for the response. Okay.
Okay.
Apart from that, yes, you did great. Introduction, the task, the interaction, the social, the diet only as mentioned, diet interaction and drug interaction to be given as safety netting. Please, if you are taking some medication for any reason, please let us or let your GP knows about it. It might interact with this medication, the warfarin, in the future because this medicine known to be having a lot of drug interaction. Don't bother about that. We can give you leaflet brochure about this medication and what can make it less effective. And if you need any help, you can contact us. Plus the diet, of course, because some vegetables make the action less. Okay. Anyone has other question or comment? Okay, post your scenario, Dr. Salma, for Dr. Samia, and I will try to read the comments. Or anyone has comment, he can share now. Yeah, Dr. Salma shared the scenario already. Ah,
Yeah.
no, this is not. This is not the scenario.
Yes, this is the scenario. You are the doctor in the neurology
Ah,
clinic.
okay.
Miss
Yeah,
Mary David.
I saw
Yeah.
the other scenario you repeated. Okay. Okay, you can read it. I will read it. Okay. You are the doctor in the neurology clinic, Miss Mary David, 23 years old. Her father has recently been diagnosed by Huntington disease. She wants to ask for genetic test to see the possibility for her to carry the disease and the possibly passing the condition to her children. Please counsel here. Dr. Samia, I will give you 2 minutes, then we can
Okay.
start.
Okay.
Those Dr. Hatem share, those modification needed if GFR less than 30. Yes, agree. Herbal also perfect. Thank you for reminding. So you can say there is a lot of interaction, and we will provide you leaflet brochure to know what can make the drug less effective and what can make it toxic in effect or highly effective. Why admission here? To treatment, the bleeding happened or what? We don't know what they will do because it's a vague scenario as a management plan. They didn't try it. However, one of the possible interaction, the endoscopy, but again, it wasn't written, so we will not go through it. But you can say it as a vague also management plan. We might do some scans for you to be sure that you are okay and your gut is okay. In the same time, you specify the gut, but you didn't specify the procedure. Yeah, we want to know if the gut is okay or not. But If they wrote for you endoscopy, proceed. If not, I believe it's not the time to explain the whole procedure because you have another task, which is convincing the patient. Enoxaparin only contraindication if GFR less than 15. Thank you, Dr. Phoebe. So it's either 15 or 30. Anyway, if they didn't mention the number or it's not advanced as we assume, so we cannot stop it or it will not talk as a medical error. From 15 to 30 need adjustment. Okay, thank you. Other comment scenario, please. Can you?
Assalamu alaikum.
Alaikum salam. Yes, Dr. Rashid.
I think well done by Dr. Salma, mashallah. I think if the patient candidate ask for, not candidate, the surrogate ask for the management plan, we can mention the endoscopy as an option. It could be we
As
need
an
to
option,
monitor
exactly.
you. Yes, endoscopy, and they may stop this medication also in enoxaparin. Okay. In general, yeah, I think so.
Yes, I agree.
But
So if raised by the surrogate, yes, he might. By the way, he might raise it as a specific point. He might tell you, doctor, they told me
yes,
about camera
you can
scan.
mention
Will you
yes.
do?
Yeah.
So yeah, you can. But I mean, don't go through the details
Yeah,
because
no
you have
need.
another
Yes.
task. Yeah.
Yes.
And be ready if the patient refuse totally. You have to say, I will arrange a meeting with my consultant. He is in better position to convince you. If he's still convincing, so I am sorry. We give you a paper called DAMA, discharge against medical advice. And if you are insisting to leave, we will let you sign this paper. So this is the other steps of refusal.
Yes. And the danger of dropping of hemoglobin also. Dropping.
Safety netting, yeah, but
Yeah. By
it
this
will
bleeding,
take.
ongoing bleeding, and he has heart failure. Also, you can also try to
Yes,
convince by this way
yes,
also
yeah.
to raise this point for him.
So a lot of thoughts and ideas, but please try to convince the patient and be sure that she will be convinced that there is serious condition ongoing. Try to conduct this message to her in order to let her stay. By any idea, I mean. So this is one of the ideas, serious of the low blood count and your heart is weak. It's a good idea also to convince about them. Thank you, Dr. Rashid. Multidisciplinary team by Dr. Hatim. Multidisciplinary team is jargon. Yes, group of doctor. Always mention we have group of doctor or refer you to a group of doctors like that. Why no discussion of treatment plan? Because it's not clearly written, Dr. Mahi. If they wrote for you possibly plan for endoscopy, you will talk about the endoscopy from A to Z. If no, I believe don't go through it in details, but you can give it as an option. Yes, we might do a scan, and if I ask you what scan you mean, doctor, it might be either a scan by imaging or scan by camera scan. Can be used with modified dose, the enoxaparin. So we'll not go to the details of medical point. We just say it as possibly as an error. Then it was not error, so no need to think about it more. If you are ready, Dr. Samia, we can start.
Okay,
دكتور
ready.
باسم سوري سامحني يا
Yes.
دكتور باسم كنت بسأل حضرتك سؤال
Uh,
معلش سامحني
yes, go ahead.
أنا كنت مرة سألت حد من الناس اللي هم
But in
بيشرحوا
English, yeah, okay,
yes,
try because we have.
he said to me it is not your job to decide this is medical error or a complication of medication. Don't يعني
Estimate.
strip your mind that to read the scenario and
Okay,
you decide it is because
it will be written.
only from you they want good communication, welfare, and if patient is still you will say to him this is not a medical error, this is a complication, but no need to go deep in this and apologize and like this. And if the still patient wanted to complain, he can go to complain, and it's a team of complaint who can decide this is a complication or error. And the examiner will not fail you if you take it as an error and it is was a complication or the reverse. What's your opinion for that?
No, they will fail you if you do apologize without error. or if it is an error and you didn't apologize, they will fail you definitely. Okay, let's go it in another way, Dr. Muhi. It's a good question, by the way. If it's not our task, yes, I believe it's not. They will write for you in the paper. Your task is
Our job.
so. Okay, this is the point. If you want to say it in this way. It will be written clearly as a task in the scenario. So your task will be written in the scenario. Your task is 1, 2, 3. Follow the task. Don't think more. But sometimes there is vague scenario. But we are speaking about all and every possible scenario in the exam. But in this scenario, I believe it's not error because it's clear, no error here, and the task also is not about an error. Okay.
I'm not talking about this scenario by itself.
Yes,
I
I'm
speak in
talking in
general.
general also. I'm talking in general. Yes, you are right, of course. But don't assume that the examiner will not fail you. They might fail you if it is an error and you didn't apologize. And the opposite, if it's error, if not error and you apologize, they will consider you failed in this station. Okay,
Mm.
clear now?
Okay. Okay.
Okay, thank you, Dr. Mahi, for the question. Let's start, Dr.
Yes, yes.
Samia.
Okay.
Yeah, here you.
Hello.
Hello.
I'm Dr. Ahmed. I will be the treating doctor for today. May I confirm you are Miss Mary, 23 years old?
Yes, I am.
Nice to meet you, Miss Mary. Can you tell
Thank
me,
you.
Miss, you are here to discuss. Can you tell me what do you know about your condition so far?
So, doctor, it's not my condition. Actually, it's my father. He just recently diagnosed with Huntington disease, and the doctor said that it is an inherited disease. So I am here to ask about if I can do the genetic test to know if I will inherit this condition or not. It's very important for me. I'm very worried about that.
I'm so sorry, Miss Mary, for what happened to your father. So can you
Thank
tell
you.
me what do you expect from our meeting today?
So I expect you to guide me how to do this genetic test.
Mhm. Okay, Miss Mary, I really appreciate your concern. So,
Mhm.
do you know about this condition, Huntington?
A little bit. I know that my father is in very bad condition now because he is forgetting things. He has some shivering and tremor in his body, and that's very, very, very bad.
Yes, Miss Mary.
Mhm.
Do you want me to explain more about this Huntington?
Mhm. So yes, yes.
Okay, Miss Mary. As you told, this disease, let's assume this is the brain. Okay, it's affect
Mhm.
an area in your brain.
Mhm.
Um, and this disease is, as the doctor said, it's inherited. That's mean it's run in families. So actually it's mean that you have, if your father having this disease, you have a 50% chance to get this disease.
Mhm.
I'm so sorry to tell that. How do you feel, Miss Mary?
I'm very frustrated because of myself and because of my children also. That's why
Mhm.
I'm here today.
I really appreciate your concern, Miss Mary. So, this disease actually, the cause, it's not really um, known, but actually it affect the brain in many ways. The same what happened to your father. It can affect the movement. It can affect the understanding and affect the emotion and even affect the memory. It will be more forgetful and having abnormal movement. Um, so, Miss Mary, this disease actually um, as I told you, have if you have a 50% chance to get this disease, and for your kids, let's make it. Let's discuss your condition now, and we will refer you to the genetic counseling, and he may do the test for you, and let's hope it's not positive. Okay, but if it's positive, he can discuss with you what will happen about your children in next let's step by step, not jump to other steps. It's okay.
Yeah, I understand what you are saying, doctor. So my children, I have two children, one 6 years old and the other one is 3. But I'm planning to have another one. So what do you think? Do I have to cancel this plan, or I don't know? I am very frustrated.
I really understand your condition, Miss Mary. I know this is frustrating actually. So let's do the test for you with the genetic counseling first, and then may discuss further about the coming plan of pregnancy. So it should be planned actually, involve a group of doctor, including the woman doctor and the genetic doctor also. So before taking this decision, you should stay with this team and discussing the other possibilities and what happened in the future. Is it okay, Miss Mary?
Yeah, I have another question in my mind. So, if I tested positive for this condition, what about my insurance? What will happen?
I really understand your concern, Miss Mary. Actually, I don't have the information for now, but I promise you that I will contact with my consultant and know all the information about the insurance, and then we will inform you back in the next appointment. Is that okay with you?
Yeah, that would be great. Okay, so you are going to refer me to the genetic counselor, you said, right? To test for
Yes,
this condition. And
exactly.
then after that, if I tested positive, is there any hope that this disease could be curable?
I really understand your concern, Miss Mary. I'm so sorry to tell you that it's not curable. Actually, we were just giving some treatments to control the symptoms for this condition, but I'm sorry to tell that it's progressing. Like the outcome of this disease actually is not very good. But don't, Miss Mary, we will support you, and you will be under the care of group of doctor, including um, the nerve doctor, and even the genetic counseling, the woman doctor, and all, and even the physiotherapist and the occupational therapist. They all will help according this disease and the complication happen with this disease. Okay,
Okay.
do you have another concern, Miss Mary?
No, thank you. You've answered all my concerns. Thank you so much.
Okay, can I ask you a question, Miss Mary?
Yeah, of course.
Are you smoking?
No,
Do you drink much alcohol?
only occasional.
Okay, Miss Mary. What's your job?
Okay, I am a teacher.
Okay. Okay, Miss Mary. So for now, we cannot discuss the any further management unless doing the test and confirming
Too
if
many.
you have just confirm that you have the disease, and we hope no, because as I told you, it's 50% chance to have this disease. Then further, we can discuss about the children, um, the possibility of having the disease also. Is it okay?
Okay, doctor, my father decided not to tell my siblings. So I believe that this is their rights. So what do you think about that?
I really appreciate this question, Miss Mary. I really advise to sit with your father and told him the effect of the disease and just to have a more support from his family, all part of the family. It's better for him to tell them, so to know the disease and so interact with him appropriate to his condition. So I really advise him, and if you need help, we can sit with him actually, and like talking about family support as a very important step in management of this disease. How do you feel?
Yeah, that's good. But if he refuses, can you just tell my siblings?
Actually, I don't think his right actually to tell or not to tell about his disease. So we cannot tell them.
Perfect.
Thank you, doctor.
Perfect. Time is
Thank
up,
you.
and Dr. Salma tried to trap you again by last question, but you did it perfect. Okay, time is up. Now you can comment, Dr. Salma, then I will comment.
So
This is my first time, Dr. Basim. Be gentle, okay?
you are very lucky because I don't know how to comment usually. I was consumed with the scenario. So I believe that you have some problem with the introduction because you did perfect. Of course, you did very good. You answered all the things. You have to put some effort on convincing her not to do first. I will read for you the NHS.
Okay. Actually, I don't know about the Huntington very well,
Yeah.
so I didn't know how to answer.
Yeah, some people in your condition sometimes decided not to do this test unless they have any symptoms because there is nothing to do for the disease or to cure the disease. So they don't want to bother themselves or this will give them more anxiety, to more anxious. So some people sometimes decided not to do this test, but it's your right to do the test. And if you want to do the test, I will help you and guide you to the genetic counselor. I hear this before, I think, from one of the mentors, and I read it also in the NHS now. So I don't know what do you think, Dr. Basim and the others.
Yes, I will tell you now, but after you finish the comment, I will comment on this part.
Okay, then in the introduction, I don't remember, but you have some hesitation in the introduction. In the beginning, you ask the patient, actually, you ask the patient, how much do you know about your condition? We are here today to discuss some issues.
Yes.
Yeah. Just a minute, let me see the scenario. Her father has recently been diagnosed by Huntington with Huntington disease. I don't know how to start this. She don't have anything. She don't have a condition. So we can skip this and ask about the expectations. I don't know. I need guide in this also.
Yes. You have to. Let's start the introduction as a confidential meeting because this meeting and this point is very sensitive, right? So in this scenario, never ever invite anyone, Dr. Samia, and you did it. You didn't invite, which is perfect. You confirm the age, the name, and how are you? How do you feel now? How is your father? Is very important question. I wrote it just to remind myself on the comment. How's your father? Because she came now concerned about her father. My father is having a new condition, so you can ask how is your father right now? Is he fine, and so on. The point of asking background, yes, you can ask. What do you know? Tell me about the condition, or what do you think about the Huntington so far, and what's
Yeah.
expectation about the meeting. Then Dr. Samia did great question when she said, "Do you want me to explain?" Of course, she will ask because just now I read or my father diagnosed with Huntington, so it's
Huntington.
good question to ask. Yes. I
Mm-hmm.
believe she did a perfect introduction, apart from the confidentiality, which I prefer to do it in such condition, genetic condition, which is carrying out poor outcome, like Huntington.
Yes.
This is the first. Yeah. The second
Mm-hmm.
point, you ask about how to talk about encourage or discourage, or what Dr. Samia did is perfect. First of all,
Mm-hmm.
she refer you to the genetic counselor, and if you want to do or you don't want to do, they will sit with you and they will
Mm-hmm.
see what's the better option for you, the cons and
Yeah.
pros, or the pros and cons, and accordingly you can choose or you can decide. She did
Okay.
perfect in this, but when you raise the point of pregnancy, now the concern changed to encourage or not. So here in the pregnancy, I can encourage the patient to do the test in order to have a safe baby. Of
Mm-hmm.
course, after confirming her diagnosis, as Dr. Samia said, we want to know if you are already having the condition or not. We gonna do the gene selection to have a safe baby and safe pregnancy. Clear?
Mm-hmm. Mm-hmm.
Okay. The missed point in the explanation only, Dr. Samia didn't mention the anticipation.
Mm-hmm.
Should be raised as in this genetic condition or this familial condition. A genetic also maybe as no, we must consider it's not jargon. Okay, let's say about the anticipation. This condition particularly, and some other familiar condition, comes in early generation or early age in the next generation. I'm so sorry and sadly to say this information. So it might be as what's called anticipation. And if you have the gene or the code, unfortunately, I am sorry, it might come to you at early stage than your father had. Okay. Back to the other concern for pregnancy and cons and pros. Already done as Dr. Samia did exactly. So let's go to the last concern. When you try to trap here, when you said my father doesn't want to tell my sibling, I
Yeah,
think
I felt
this is the
it's
only.
too easy for her. Up to
No,
this
no, but
point, it was too
suppose.
easy for her. She did it perfect. That's why I surprised her with this question. And
Yeah,
she need
but
to emphasize on
no, no, no,
the right of her father
no,
to
no.
keep it.
Yes, the
Mm.
second concern in this point, okay, I believe she did it perfect. But the first part, no, why her father should tell the siblings? The
No,
siblings
yeah, she
means,
should.
yeah,
Yeah, that's what I want to say. Firstly, you tell the daughter your father has full right to hide
exactly,
this or express it
exactly,
to your siblings.
exactly,
Nobody can force him to do this. He
exactly.
has full right to do that. But if you need our help in this, we can make an. I believe they can help her because she is frustrated because she knows that her siblings might have the condition and they might inherit it, and they want also to plan for their children like this. So if she insisted and tell you no, but I need my siblings to know, then you can tell how we can set an appointment and sit with your father, not with her, with your father, and discuss this with him. If he still refuse, he has the full right because he has the capacity. If he agrees, that is another thing.
Yeah, let's clarify it again.
Mhm.
If your father doesn't want anyone to know, yes, this is his right, and he has the right not to inform anyone, and we will not inform anyone. This is his right, and this is top confidential point to be hidden or to be not disclosed to others. Okay, this is regarding this point. The other point, if the siblings have any finding or features of the disease, they can come to us and we will sit with them to explore and to explain and to refer them to the genetic to sit with them in the best interest for them. This is another point. So the siblings, the father, separate point. For the father, of course, we don't encourage. Dr. Samia, I think you were trapped in this. You told her, no, he should inform. Why he should inform? It's a very sensitive condition.
Yes.
And if he inform them, it's breaking the confidentiality. So it's his confidentiality either to spread or to inform or whatever. So don't encourage, don't discourage. This is his right to do so or not. Okay, if the siblings, I mean her brother or her sister, having any features of the disease, they can come to us and you can tell about leaflet brochure. They can you can read about the condition, and any one of them has any manifestation of those, he can come to us and we can do the best interest for him. Okay. Don't forget the mood change here, because most of Huntington having people having mood change or low mood and up to suicidal thoughts. So you can explain it while explaining the condition. Why? Because this type of disease need to be accompanied and not to be alone. The father, I mean, or any patient having Huntington.
Yeah.
Okay, because
Actually,
of
Dr.
this
Basim, I want to ask you
depression.
if
Yes.
in the social, if she asks her, what about your mood now? Is this considered history taking or part of the social?
Yes. Why you want
If she
to
said,
ask
I
about her
am
mood?
frustrated and sad like this, then she will tell her, we will help you as we can, we will refer you, and so on, so on.
No, no. We are talking now about the father. Why she doesn't have any manifestation? You can explain the condition to the father, about the father, not about her.
Not
And
about
if
her.
you want, you
Okay.
can say to, yeah, you can say yes in the future if you feel any of these, because she might go for genetic or not.
Yes.
She might have the disease or not. So you are not talking about her now. She doesn't have the condition now. She might have or not. Whenever she have the positive gene or a genetic testing came as positive, this time will be as a diseased patient or as a manifested condition, or even sometimes it has the gene without manifestation, so it might present later on. So don't ask here as currently any condition or any complaint you have. You can ask about the father because the father already tested as positive. Clear now?
Clear, yes. So we don't
Okay.
have to ask her in the
No,
beginning, are you the
no,
next of kin
no.
of your father? Because she's coming for herself, not for her father.
Yeah, coming for herself. We are talking to
Yeah.
her, not about.
Just we will tell her, we assume that your father is happy discussing this issue with you
No,
for the
I don't.
No
confidentiality.
need, no need, no need,
No
no
need.
No
need,
need also.
no need.
So
Yes,
how to
لو
confirm the
سمحت
confidentiality in the beginning?
yes.
How do you suggest?
You are
ممكن
the one.
كومنتي هنا طيب ممكن كومنتي
So
بسيط
yes,
هنا
sure.
طيب يلا هي أول من طبعا تدخل وتقول له يعني
But
how
in
are
English,
your
please,
father
Dr.
now
Tago. Yeah,
okay
Dr.
no
Tago.
sorry okay first say how are your father now after that can I ask her tell me how can I help you with regard the the introduction for your this lady say like that you can avoid it any interruption in the question how are you condition for your father and like that just to say to her can tell me how can help you so far but after that he say to you I am worried about my father conditions and I maybe I get this disease for me also and for sibling and after that enter the scenario okay
Okay,
regard that
yeah, it's another option, but the introduction again should be assured about the confidentiality and confirming the patient name and the age in this scenario, because you are talking to the daughter about her condition, not about the father. And you
yes
are
yes
explaining the disease because she want to know about the condition. It might carry the gene of this condition. I think it's clear now. Yeah, thank you, Dr. Ratagwa. It's a good option also to say, how can I help you? It's one of the different beginning, as I mentioned, how are you? How do you feel? How can I help you? Anyone can have his approach or can have his approach and follow whatever he wants. But it's not strictly to do this question in any scenario, okay? But it's okay. It's a valid question to ask. How can I help you today? Okay. Any comment, Dr. Samia? Dr. Samia, thank you, Dr. Takwa, for your. Any question from anyone? Dr. Salma, Dr. Samia?
Did you do this scenario before, Dr. Basim?
Yeah, we have Huntington.
Because I want to, I want to go revise it from.
Yeah, it's in the counseling disease. It's one of the topics was discussed before.
Thank you.
Most welcome, Dr. Salma. Yes.
Thank you so much for the opportunity, Dr. Basim. I really
Yeah,
enjoyed that.
very perfect beginning as the first practice. You impressed me today, Dr. Sami. I
Thank you
thought
so much. Thank you. This is
really
very promising.
you are well trained. I think you practice a lot before and you are perfect. This is what I feel today. And you are confident as well.
Yes.
Apart from the introduction, you were little stressed, but you overcome
Yes.
this problem later on. Yeah,
Yes.
I feel that. Anyway, perfect, Dr. Samia and Dr. Salma. Thank you for practicing today. Anyone has other comments? I will read the comments now. And social history, should we ask about patient social? Yes, you can ask about social, who's taking care of you and who's living with you, who's living with the father, how's your father now. All this question is valid. The job, of course, you have to do to ask about the job, and also but it's not in her condition for father. If you are talking to Huntington patient already manifested, you have to talk about driving because he might have tremors during driving, which also might harm his driving. Okay, so it's one of the point or question you can add if the patient already manifested with the disease. Next of kin, social no need here because you are talking to the daughter herself. I mean, ask about her social, about her father. Yes, I asked the question for how is your father now? Don't say nice to meet you. I believe this question, this point or this protection, yes, introduction. It's not good to mention it because he might tell you, not I'm not nice to meet you, doctor, and you will feel distressed by this answer. For example, if you said to him, you are waiting for him to say yes, nice to meet you too. But if he said no, I am not in nice position to say the same, or not likewise, doctor, you will feel distressed because it's not expected answer. So better to avoid it because he's in a hospital and he is sick and he don't or he doesn't want to sit with any doctor and he doesn't want to see you even. So not to say it is good. Thank you, Dr. Hatem. More severe, yes, Dr. Agwa, this is our explanation, anticipation. It might be in advanced and early stage and early age, aggressive manner, of course. If she asks about better to do the test or not, which option better? Again, the best answer will be with the genetic counseling team. However, if she insists to know what or not to do or not, you can say if you are planning for pregnancy, this is the only indication to do the test in order to have a safe pregnancy and baby. This is the only pros. Yeah, good. I remember the point of the insurance, yes. So again, as Dr. Samia did, is perfect. I'm not aware about this point particularly. And if you want, I can ask my senior. Don't say my consultant because the consultant doesn't prefer to ask him about all details. So I prefer to ask my senior and I will update you about the answer. This is the first option. Second option, if you know the information, which is the insurance, if you have the test, it might be changed. So it will be affected by the diagnosis. In another way, it's another cause which they carry more stress on the diagnosis. So if the point to discourage, this is one of the point discourage the test, the insurance. So the insurance point will make the patient not happy about the positive finding or the positive test. One of these is genetic and insurance. Sorry, the insurance. If I am diagnosed or the patient diagnosed with Huntington, the insurance will be affected. Another point which discouraged the test, as Dr. Salma said, the stress I will or the patient will live in all his life. So the patient will be anxious. I have the condition. I might have the tremors, the mood, the depression. I might die early. My kids, my family. So
No treatment.
sorry. No
Also, no
treatment.
treatment.
Yes.
No benefit to discover
Perfect.
early.
Exactly. It's
Nothing.
not curable. So I will live with this condition lifelong. So in order to avoid this, no need to do the test. Whenever I have the manifestation, okay, I will go to the doctor, and he will help me by any team, whatever the team, either physiotherapy, social support, because no pharmacological option in this scenario. This is the way how to outweigh the risk and the benefit of the test, or the cons and the pros of the test. The only advantage to do the test to have safe pregnancy and safe baby. Otherwise, all are disadvantage. Stress and also insurance affection and no cure. So no need to do the test. Okay, so the only advantage, safe baby, safe pregnancy. Apart from this, other points will be disadvantage. Okay, clear now for all? So if again the question will be, if she asked me, will you advise me to do or not? The only indication or the only thing make me convince her if she want to have a pregnancy and a safe baby. In this way, I can encourage to go to the counseling or the genetic counseling team, and you can do the test to have a safe sperm or safe ova according to the gender. The second thing, don't encourage if you don't know. You can refer safely to the genetic counselor team, and they will address all these concerns. Okay, this is general law in genetic condition. If you don't know, you are not sure about pros and cons, refer to the genetic counselor team, and they will decide the best interest for her condition. Clear for all?
Yes,
Yes,
thank you, Dr.
clear.
Bassel. Thank you.
Okay, thank you. Also, Dr. Hatem, and last comment, I think better to say we will refer you to genetic counseling. This is what I said lastly. They will sit and discuss with you about better option. Exactly. This is the best way if you are not sure about everything. Okay. Any other
Also,
questions?
you can give him hope. Also, you can give her hope in case the test came back negative. She will be relaxed the rest of the time like that.
Yeah, if the test came negative, but it's yeah, it's 50%. But again, 50% also is another number, and it's high number. And if she doesn't have the manifestation, no need to do the genetic. Okay, and if she know that the condition, she will not receive medication, and it will be as a long-term disease.
Yes.
So better wait and see. Unless you are planning for pregnancy, now you can do the tests. Apart from this, no need to go for the test at all.
Yes.
Clear for all? Okay. Thank you, Dr. Rashid and Dr. Sami and Dr. Salma. Any comment or question before ending the session? Okay, well done, Dr. Samia again and Dr. Salma. Nice session and good performance, both of you perfect. Hopefully, we will see
Thank you.
a,
Thank you.
most welcome. Yes, a new candidate in the coming days. Some doctors selected
Inshallah.
in the next diet. Yeah. So anyone interested to practice, just send me privately, and I will select according to the prior sending to me. Okay. Any
Okay.
question before ending? Okay. Okay. Thank you, everyone. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.